Hello everyone, welcome to another episode of Quintessence. In the last episode, we saw the major changes to the A&M guidelines in the lines of medical decision making and total time spent. In today's episode, let's look at the specific changes that have been made to MDM and total time spent.
According to the changes in A&M in the year of 2022, medical decision making includes establishing diagnosis, assessing the status of a condition, and selecting a management option. Medical decision making in office or other outpatient services code set is defined by three elements. The first one is the number and complexity of the problem or problems that the provider addresses at the time of the encounter. The second one is the number and the complexity of the data that has to be reviewed and analyzed. The final element is the risk of complications, morbidity, and mortality of patient management decision made during the visit.
Prior to 2021, the four levels of MDM, namely straightforward, low, moderate, and high, were derived based on checkboxes and bullets. This has now been revised. It will now based upon three factors: problem address, data review, and patient risk. 2 out of 3 of these factors should be reached to determine the overall level of office or other outpatient visit.
Now let's look at total time spent. For coding purposes, time is calculated as the summation of the total time spent on the day of the encounter in managing and taking care of the patient. Time is to be documented in the medical note for each of the activity to account for what has been done. The total time will include all the time that is personally spent by either the physician or any other service provider towards managing and treating the patient on the day of the encounter. This can include both face-to-face and non-face-to-face time.
Timed activities that may be performed include: number 1, preparing to see the patient; number 2, obtaining or reviewing the separately obtained history; number 3, performing a medically appropriate examination or evaluation; number 4, counseling and educating the patient or family or caregivers; number 5, ordering the medication, test or procedure; number 6, referring and communicating with other healthcare professionals; number 7, documenting clinical information in an electronic or other health records;
Number 8, interpreting independent results and communicating these results to the patient, family, or the caregiver; and number 9, care coordination. This concludes the specifics under medical decision making and the total time spent. We hope you found this episode useful and informative. For more such coding tips and updates, follow us on YouTube. Thank you.